Om Swastiastu. Today we're going to be presenting about our student project entitled Travel to Cold Climates. And this is the outline of our presentation today.
My name is SGD B2. I'm about to present to you the background of our student project, which is about cold-related illnesses. And this illnesses is one of the major problems faced by tourists in cold climate region. It can be defined as a collection of health problems related to thermoregulation disorders due to cold stress. The common type of these illnesses are hypothermia, frostbite, trenchfoot, and chilblains. Cold-related illnesses are the main risk factor for cardiovascular-related mortality. And based on that information, it is important to understand about cold-related illnesses, its prevention, and how to manage it. Then, further explanation about this topic will be carried out by my colleague.
Hi, my name is Gwen Faishaden, and I'm going to explain about problem formulation, purpose, and benefits. So the problem formulation is how does the body adjust in cold climates physiologically, what are the common illnesses during cold weather, what are the preparations needed for pre-travel to cold climates, what are the managements of post-travel to cold climate and illness.
First, let me introduce myself. My name is Danisa Putridita, and today I will explain the definition of cold injury. So, traveling to cold climate indicates a journey to a region with approximately 5,400 heating degrees days or more and fewer than approximately 9,000 heating degree days. Traveling to cold climate itself can put a traveler at risk of experiencing cold injury. For the definition of cold injury itself defined as a pathophysiology response against cold temperature that are worthy of note. Cold injury can be hypothermia, freezing cold injury, and non-freezing cold injury, which include trenchfoot and chilblains.
Hello everyone, my name is Anna Agung Istriangrini. Now I will explain about the physiological changes in cold weather. The first one is skin vasoconstriction. When exposed to cold temperatures, the body regulates its core temperature by reducing heat loss or by peripheral vasoconstriction. Peripheral vasoconstriction is a response that is carried out by reducing heat dissipation and lowering skin temperature. And the second one is cold-induced thermogenesis or CIT. CIT is divided by two, which is shivering thermogenesis and non-shivering thermogenesis. The energy source for shivering thermogenesis is involuntary or repetitive muscle activities, and the energy source for non-shivering thermogenesis is brown fat.
My name is Rusania Trikira, and today I will talk about hypothermia. Hypothermia is a medical emergency that happens when a person is exposed to extreme cold temperatures and that make the body below 35 degrees Celsius. The main cause of hypothermia is a lack of heat production in the body. Hypothermia also has other risk factors, namely hypoglycemia, malnutrition, extreme ages, and endocrine factors. Lastly, for temperature regulation, the main control is in the hypothalamus. Changes in the central nervous system can disrupt the normal thermoregulatory mechanism in the hypothalamus.
My name is Josepina Dewi Prastiran. Shivering can occur in patients with hypothermia, but the symptom is not consistent and cannot be used to diagnose the degree of hypothermia. There are three degrees of hypothermia. The first one, mild hypothermia. The second one, moderate hypothermia. And the third and last is severe hypothermia. Acute management are as follows. First, stabilize the patient with rewarming patient with the passive or active rewarming. The second one is give oxygen and ensure the airway is patent. And then next is intubation and mechanical ventilation may be necessary if the patient has respiratory failure. And then establish intravenous access fluid status because the patient with hypothermia are often hypovolemic due to dehydration. And then ensure blood glucose is checked immediately. And then insert a urinary catheter if necessary. And then insert a central venous line if necessary to prevent the complication of fluid overload and to guide fluid replacement therapy.
Hello everyone, my name is Grace Valerie. I'm going to present about frostbite. Frostbite or freezing cold injury occurs when tissues are damaged as a result of exposure to cold. Long durations and lower temperatures increase the probability and the severity of this injury. Frostbite started with peripheral vasoconstriction, which then proceeded to ice crystal formation in the intracellular and extracellular compartments. Increasing vascular permeability of blood vessels causes displacement of plasma to extravascular spaces, leading to tissue ischemia. Cold-induced vasodilation occurs as a control mechanism.
My name is Evanie Iglesia. The clinical manifestation of frostbite is presence of hardness, numbness, and paleness of distal body parts such as nose, cheeks, ears, hands, and feet. Rewarming injured body parts is the first aid management of frostbite. This can be done by putting on warm clothes to the patient, to the injured part, or administration of warm IV fluids. Administration of thrombolytic drugs, such as plasminogen activators, is also recommended within 24 hours after the injury to reduce tissue damage.
Thank you for the opportunity. My name is Jiran Ningrum and I will explain about trench foot. Trench foot, which is modern term, is referred to as a non-freezing cold injury or NFCI, is a condition of cold, wet, and moody sustained accompanied by moisture. Patient's skin changes from the cold, pale, and wet to a motile and hyperkeratosic state, and often accompanied by muscle stiffness and mild fever. There are worst cases where there is no pulse on the feet and the development of paresthesias due to severely impaired tissue perfusion. The complicated cases can result in gangrene of the legs accompanied by blister that required amputation.
My name is Diachelista Anna Putri. Chilblains are a superficial and localized inflammatory skin condition with erythematous lesion related to an abnormal vascular response to non-freezing cold. Typically, the lesions are odematous, tender plaques or papule with purple discoloration or nodule, which may develop central erosion or ulceration. The first priority in management is prophylaxis, such as avoiding cold and keeping extremities warm and dry, use of adequate home heating and clothing, therapeutic measures such as the use of ultraviolet light, topical corticosteroid, and vasodilators. Nifedipine, 20 until 60 mg given 3 times daily, reduces healing time of the lesion, mean of 8 days in nifedipine group against 24 in placebo group.
My name is Stella Angeline Ispianto, and now I will present about pre-travel preparations. So the first thing to do that the traveler should do is making an appointment with the healthcare provider. So the pre-travel preparations will consist of health assessment, review of itinerary, immunizations, and the last one is counseling and education. And before traveling to cold climate environment, the traveler should prepare warm clothing such as gloves, waterproof boots, suit or jacket, and etc. And the traveler also should consider buying a travel insurance and prepare a travel health kit.
Let me introduce myself. My name is Denis Vijay. Now let me continue the presentation with the management of post-travel illness. So in some severe cold-related injury cases, the treatment duration and the recovery process might take longer time. Some of the cold-related injury even can result in long-term sequelae. The most often sequelae found is the chronic pain. So for non-freezing cold injury chronic pain management, we can use iloprost, which is a prostaglandin I2 analog, or we can also use 8% capsaicin patch, or mostly known as Kudenza, and also we can avoiding cold exposure to the patients. Next one is for freezing cold injury management. We can also do avoidance to the cold exposure. Then we can do lab testing such as TC99 and also imaging like MRI, and we also can do surgery if it is needed. And the last one is to do consultations with the rehabilitation services.
Hello doctor and friends, my name is Sisi Natalia with the 3 last digits to the number 109. Now I'm going to present about the conclusion. During the exposure to cold climates, the body might experience hypothermia, frostbite, trench foot, and chilblains. These all are considered as medical emergencies. So in terms of traveling to cold climates, warm clothing and health insurance has to become a priority list, followed by travel health kit or a first aid kit, medicines, and prescriptions.
That's all for our presentation today. We apologize for any mistakes we've done during the presentation. Thank you for paying attention to us. I close the presentation with Paramasanti. Om Santi 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 Om.